Central African Time. In our extended health brief feature today, we'll continue casting our focus on the 26th International AIDS Conference, which yesterday held a plenary session titled Ebola in Context, Past Outbreaks, Present Responses, and Emerging Lessons. Examined the evolution of Ebola virus disease from the first reported outbreak in Sudan back in 1976 to recent responses and to even outbreaks of the Bundibugyo virus in the DRC, the Democratic Republic of the Congo, and Uganda as well. Joining me on the line is Dr. Vincent Muturi-Kioi, HIV vaccine product development team lead at the International AIDS Vaccine Initiative. Dr. Kioi, a very good morning to you and welcome to Channel Africa. Thank you so much for your time.
Good morning, and thank you for having me.
It is a pleasure indeed. I guess the first place to start in terms of our conversation, please enlighten us about Ebola and HIV and draw the connection for our listeners, if you will. Where's that connection, Ebola and HIV?
Yes, I think with regard to these two diseases, especially for us as Africans, we are experiencing a situation where both of these disproportionately affect people on the continent of Africa, communities here, and when it comes to the response to try and control the epidemics caused by Ebola viruses or the HIV pandemic that has been raging for more than 40 years now, many of the interventions that we require are similar. When it comes to being able to identify cases, trace contacts, give medical interventions to prevent the spread of these viruses. The strategies from a public health perspective are very similar and can benefit us across the board.
Now, Doctor, you gave a presentation at a session yesterday, a plenary session at the 26th International AIDS Conference, currently underway in Rio de Janeiro, Brazil. What are the two takeaways you can share with our listeners at this moment?
Right. I think one of the main takeaways that we highlighted during the session was that the current Ebola outbreak is spreading faster than any of the previous outbreaks we've documented in our continent's history. And there is a need for much more investment and resources into ensuring that we are able to halt this outbreak. My presentation was on the development of vaccines that could help respond and help us stem the spread of the virus across the communities that are being affected in the Eastern DRC and previously in Uganda, which has managed to achieve control. And we were aiming to highlight the fact that there's opportunity to develop vaccines that can respond to this particular strain of the Ebola virus. There's an opportunity to develop vaccines that could impact all different strains that could cause outbreaks in the future, because we are seeing these outbreaks happening more frequently now. And we need to be able to put in place measures to be prepared before the outbreaks are identified. So we need to be able to vaccinate health workers in advance, to stockpile all these medical countermeasures, medical protective equipment for health workers, and education for the communities way before the outbreaks begin, in anticipation of what we know will be more frequent outbreaks.
Now, Dr. Muturi-Kioi, you've mentioned something interesting, that Uganda has declared itself Ebola-free. Meanwhile, just on the other side, the DRC are seeing cases soaring. What would be the main contributors here, and what should we be most concerned about at this stage?
Yes, I think it's a very good outcome in Uganda that they've managed to control the Ebola outbreak and have now managed to discharge their final patients who are diagnosed and gone several weeks without identifying a new case and therefore can declare themselves Ebola free. Uganda is a very good case of what all countries in Africa should be able to achieve, where you are able to identify cases as soon as they come up, to trace the contacts who might be at risk, to ensure that we limit the spread by having all contacts isolated and treated if they need it, and to apply all these public health measures in a manner that prevents a raging outbreak or a very high rate of spread. I think in Uganda, you've also seen over the years a very strong component of ensuring this clear public messaging and public education that enables these interventions when an outbreak emerges to be implemented quite fast. From an IAVI perspective, because we've been working with partners in Uganda, with the UVRI Institute and scientists there for many years, we have experience with putting in place vaccines in the country that were able to respond to previous outbreaks. So when they had an Ebola Sudan outbreak last year, they already had vaccines in the country and already had a clinical trial protocol approved and were able to vaccinate individuals during the Sudan outbreak in 2025 within 4 days of identifying the first case. And they are demonstrating that it's possible for African countries to create a very high level of preparedness, not just to have a public health response, but also to do the research during outbreaks that's necessary to help approve new drugs and vaccines that could help with future outbreaks.
And indeed, Doctor, just as we wrap up, I mean, if I heard you correctly, you at the International AIDS Vaccine Initiative are really at the forefront of that vaccine, or at least development thereof. Just to recap for us, in case I missed it, I mean, how far are you as the IAVI in terms of developments of this vaccine?
Yes. So the Bundibugyo strain that's causing the current Ebola outbreak, there is no licensed vaccine for this strain. There are about 4 organizations that are working towards developing vaccines, and IAVI is one of them. We are aiming to have produced some stocks of the vaccine by October or November, and aiming to conduct the phase 1 clinical trials, hopefully by the end of this year, to begin those, aiming to have vaccines that could be deployed as soon as possible once the data shows that it could possibly work.
All right, Doctor, we thank you so much for your time. Much appreciated, and the insights as well. And it is something to watch, at least the developments, and a good story coming out of Uganda declaring itself Ebola free, while we still have some other challenges in some parts of the continent. But thank you so much for the great work you do, and thank you for your time as well.
Thank you for having me.
All right, that's Dr. Vincent Muturi-Kioi, HIV Vaccines Product Development Team Lead at the International AIDS Vaccine Initiative. You are on Channel Africa, 9 minutes to 12 midday Central.